Welcome back. A number of COVID-19 survivors have reported significant hair loss, a lingering and disheartening side effect that has affected people even after they've recovered from the virus. A dermatologist in Cape Town, Dilshaad Asmal, has said that the physical and emotional stress that a COVID-19 patient experiences could lead to a reversible hair loss condition called telogen effluvium. We speak now to another hair specialist, Trichologist Kuda Mupawose. Very good evening to you, and thank you so much for speaking to us. So, firstly, let me start with this. I mean, somebody watching would say, what has hair got to do with it? What is the link?
Good evening, and thank you for having me. Unfortunately, hair always end up suffering when somebody does experience a traumatic experience, whether you have lost someone or something is stressful on your body. So the end result is you're going to lose your hair. Unfortunately, because our body has been geared in such a way that it does not recognize hair as something that is so important. So when your body is going through some stuff, your brain is geared in such a way that it will send life-giving nutrients to life-giving organs. And hair is one of those that is considered the less, unfortunately.
So tell us what scientists like yourself, as I mentioned you're a trichologist, what have you found in terms of the symptoms of a COVID-19? There's been a scientific study done. Tell us more about it. Was this always known, or has there been growing evidence of this?
This is something that is new. A lot of patients that have recovered from COVID have, after not just maybe 2 months or 3 months, but this is happening 4 to 6 months after they've recovered, and they feel that they are back to normal, and then suddenly they have been losing hair. There's been studies that have been done, and evidently it's showing that most patients, I mean, there is one study that has just been done. I think it was on 1,700 people that this study was done, and a quarter of them suffered within 3 months, and another quarter, which makes it like 50%. So the studies are still going on, but there is evidence that is pointing out that one of the post-trauma syndromes is hair loss.
Now, we have noticed that with the COVID-19 virus, first of all, we now know that there are various variants, but not everybody reacts to it the same. Does it affect different demographics differently as well? The hair loss,
No, apparently everyone that has suffered from COVID, it's not sparing you based on you had mild symptoms or you had severe reaction. But on all those people that it has happened, obviously the significance of losing the hair is different per each individual. But there is a bracket on everyone that has suffered from COVID.
Just the race, gender factor, are there discrepancies? Obviously, how you would deal with hair loss with black hair would be different with how you to deal with hair loss in white, Indian or colored demographic, as it were. So tell us a little bit more about that, what your findings have been, especially also between male and female. Some people are bald, so is it that easier to notice?
No, actually, this has been evident mainly for people that have been keeping hair. So usually this is the female gender, So most women, and this is not race, it's all races. So be it your black, Indian, white, they have the same results. And for guys that have been keeping longer hair, I'm not talking about the guys that are already shaving, because then you will not be able to see. But most of the people that have been keeping hair, there has been a report of hair loss. And some of them, they don't even realize it's because of COVID. Because they then start suddenly seeing their hair is shedding, and you're shedding more and more hair than natural. So that's what has been.
Could it just very quickly, the treatment of their hair loss, any suggestions?
There's so many stimulators out there. So what I would advise anyone is that you don't need to panic, because the more you panic, the more hair you're gonna lose. So it becomes a vicious cycle. So if you do find yourself losing and shedding more hair, the best thing that you can do is, there are so many products that are on the market that one can actually just go in, over-the-counter products. So maybe the best advice I can give anyone who has suffered from COVID, before you start losing your hair, maybe start using stimulants, hair stimulants, because this way, yes, you're going to shed the hair, but at least you have stimulated your growth, so that, you know, when your hair starts shedding, you've got hair that will cover up.
All right. Trichologist and hair specialist is Dilshaad Kuda Mupawose. Thank you very much for speaking to us, talking to us about COVID-19, post-COVID symptoms, many people reporting hair